How were telehealth CPT codes rapidly adapted for virtual care? Imagine needing a doctor but being stuck at home or miles away from a clinic. Suddenly, virtual visits become the only way to see your healthcare provider. That shift didn't happen by chance. It was driven by a big event that changed everything. The COVID-19 pandemic made healthcare providers and insurers rethink how they deliver care. Before this, telehealth was limited because of strict rules and high equipment needs. Doctors needed special cameras and software, and patients had to be in certain areas to qualify. These restrictions kept telehealth services from growing quickly. When the pandemic hit, those rules were temporarily lifted. The government and insurance companies allowed providers to use existing billing codes for virtual visits. They also made it easier to bill for audio-only calls, which many patients could access with just a phone. To handle the surge, new CPT codes were created. CPT codes are the numbers used to tell insurers what kind of service a patient received. For example, codes for new patients using video visits are 90,000 to 98,003. For audio-only visits, they are 98,000 to 98,011. Established patients have their own codes, like 90,000 for to 90,007 for video and 90,012 to 98,015 for audio only. These new codes simplified billing because providers no longer needed to add extra modifiers to explain the service. This made it easier for providers to get paid quickly and accurately. The new codes also helped insurers understand the type of service provided, whether it was a simple check-in or a detailed consultation. Because of the pandemic, these changes were made fast and widely adopted. They allowed healthcare providers to keep offering care without risking patients or staff. The quick adaptation of these CPT codes also encouraged more healthcare companies to develop telehealth platforms. Now, many insurance plans cover virtual visits just as they do in-person visits. This shift made healthcare more accessible and flexible for everyone. So, in short, the rapid change in telehealth CPT codes was a direct response to the pandemic. It helped remove barriers, streamline billing, and keep patients connected to their doctors during a challenging time.